I think they have pretty inexpensive batteries that are for sale at Canadian. I don't know if we need to get a new battery.
Alrighty.
See a TI there.
We are at 3:30 here, so let's get the party started. Good afternoon, everyone, and welcome to this May 6th, 2025 regular meeting of the Committee of the Whole of the City of Powell River. I'd like to call this meeting to order, and we start by acknowledging we're holding this meeting on the traditional territory of the Tla'amin Nation, who have stewarded this land for thousands of years. I know Councillor Isaacson messaged me that she's just running a few minutes behind and should be here soon. I imagine Councillor Elliott will be the same. So we'll get started over here. Can I have adoption of the agenda if there's no changes? Councillor Southcott moves to adopt the agenda. We don't need a second anymore. So all in favor? It's approved, unanimous. Moving into our public input period. So this is an opportunity for members in the gallery or online who have the opportunity to provide some comment for a couple of minutes on topics specifically under legislative matters, committee recommendations, or new business. But I look at the schedule, we have something on new business. So if there's anyone in the gallery that did want to comment on the new business matter, then now would be the time. But I don't see any action moving towards that. So we will move right along to our delegations. 5.1, we have a delegation from the Powell River Community Foundation regarding the promotion of their 25-year celebration. So I welcome Mr. David and Marg Hodgins.
Just some history. We started off last year trying to figure out what are we going to do for our 25th. And in 25 years, we would, fortunate to bring in about $900,000 in the community, mainly for our affiliation with the Canadian community federations across Canada, which there's 500 charities, community charities like us. There's actually 62, I think, right now in BC, 5 more recent ones. But anyway, we have generated through federal and provincials the 500,000, 400,000 is what we have done in 25 years through our own fund. We decided that a lot of the charities that we have in the community, I'm talking currently right now, registered charities, do a lot of very fantastic work. They sit in the background, they do their thing, and then they disappear. So we thought we would do an event to celebrate all charities. Our foundation is going to fund it this year to get it on the ground. And then maybe next year, all going well, we'll come with our hands out for a helping hand. What we would like from the city, though, is permission and access to road barriers and pylons so we can keep parking separated. And we're going to do this event, which is going to be at the Evangel Church in Cranberry. And they've generously loaned us their facilities and grounds for this event. So basically, that's it in a nutshell. And the other thing is, too, part of our event is going to be an awareness to people with disabilities. And we have been advocating for accessibility, i.e. wheelchairs, and actually babies and strollers have the same issues as small wheels. So we're going to do an obstacle course. And I like to challenge city or staff or the worker bees to sponsor a team. And what we're doing is all the charities are going out and using that event to sponsor money, which they will earn and goes back to their charities. So it stays in the community, stays in the charity, and it's a fun event, but it's going to be bringing awareness to people with disabilities. We'll have a variety of events in that race. We're going to have slopes of 1 and 12, 2 and 12 to get people aware that when you get into a 2 and 12 and you've got a person, a 150-pound person in a wheelchair, it's a little difficult to navigate. We're going to make a rough surface area. We're going to make a pretend gate where someone has to open a door, but it's going to be a gate. We're going to have a tight obstacle that they have to wheel this wheelchair through. And at the end, they got to pretend to wheel it into a vehicle or a bus and strap it down. And just as an event, just to bring awareness. So this is what our intent is.
And I'd like to just put in there for anybody who's concerned that we are not having disabled people at risk in a wheelchair. This will be all able-bodied people in the chair and maneuvering it. So nobody will be put at risk.
That's why it's not, quote, a race. It is just an obstacle course.
Awareness.
Okay.
I think to this point, we have 9 or 10 of our local small charities who are setting up booths and doing their own awareness platforms at the same time. So we're hoping to bring awareness to what the Community Foundation is, we are, and how we function, and how we serve the community, as well as letting other small charities make themselves more publicly visible.
That's basically it. Questions?
Awesome. Thank you. Any questions from committee? Mr. Mayor.
Thank you very much, Arg and Dave, for coming out here today. I'm well aware of the benefit that the Community Foundation has provided to many foundations and organizations who basically are run by volunteers. My question to you is, with regard to accessibility, what would be an improvement that has been made in the city in the last couple of years that you think is a step in the right direction?
Putting me on a spot, because basically things that we've been looking for have not happened. So you're really putting me on a spot. Wellington Beach access has been denied. Proper wheelchair access via the transit bus, the conventionals, has been denied to the upper parking lot at the complex. Small issues. Years ago, we used to have access to the beach at Wellington Beach. There was 2, quote, campsites now, which didn't exist. It was for people that would want to go down there for family events. They made arrangements through the city. They got a key, they got a pass, they signed a document, and they got to the beach. Those 2 spots were turned into campsites for money. So the public lost access.
Basically, what we're seeing, Ron, is that, Mr. Mayor, is that access hasn't improved that much in the avenues that we travel with.
Thank you very much, and hopefully we can initiate something that will help improve that access. So thank you.
Councilor Selchuk.
Yeah, thank you for doing what you're doing and all of what you have been doing for a long time. I also was involved in a study, fairly big study that involved Susan Jersak and a few others, which I'm sure you're familiar with. And I think that has had some attention over years, but and I think there have been some small changes there as well. But anyway, my question to you is, you mentioned only 9 or 10 charities. It seems to me that there are a whole lot more charities in this town. 50.
Dave, yeah, I've got a
There's
question.
57 registered charities in Paul River. A lot of them are, quote, churches, and that's fine. They're registered.
Mhm.
Non-registered, I have no idea, but I can tell you it's a huge number. We have gone out, canvassed all charities, registered charities in the town, looking for participation. A lot of the reasons why they are not, it's called volunteers. Lack of volunteers. They burn out doing their normal functions. And to be asked to do another event, they basically look at us with deer in the headlight look and go, we can't do it. We have a prime example. We have 9 directors. We have
You're
2.
looking at the committee.
You're looking at it.
You're looking at the volunteer base for doing this.
So this
event.
is typical of other charities, typical of other even non-profits. They do their thing, they do it well, but they're strapped for extras.
So if I may, that's registered charities that are registered with the Palliver Community Foundation?
No, these are registered charities through the CRA, federally registered charities.
Okay. Did you reach out to all of them? Because I happen to be the president of one, which, you know,
I have sent emails out to as many as I can find contacts to, and heard nothing.
Oh.
We've had advertisements in the paper, and only had 1 response from the paper. Trying to track down names and numbers through a CRA website is, well, I'll let someone else play with it, because at my age, I have enough problems with computers and technology. And that's the issue.
website isn't.
There's no one place where a person like yourself, me, can go to, quote, Paul River and get contact numbers for registered charities.
We've reached out as best we can. We've put it on Facebook. I think it's
Right.
on her website as well.
The Peak just did an article.
Yeah, awesome.
And if we've missed some charities, put the word out, reach out to us. We're more than happy to have participants. But there again, it's a challenge to track everybody down.
We have a few weeks yet, so
Yeah, we do. I mean, we
We're
have
more
tons of
than-
space.
you have your phone number.
Yep.
And you
Thank you
can
so
knock
much.
on our door.
And in terms of your request, Director Gao, is there anything that council needs to do, or is that staff can handle the request for materials?
Through the chair to yourself, I think in this case, staff have historically worked on initiatives like this. So unless you wanted to formalize it, I think we can convey this to the Director of Infrastructure to work directly with Mr. Hutchins and Mrs. Hutchins, and just to ensure that those traffic barriers and cones are provided for the May 31st event.
Perfect. Well, thank you, Mark and Dave, for coming. I look forward to being there and participating. And if anyone wants to get involved, the email address is the info@prcommunityfoundation.com. Still a few weeks to go, and let's hope for some good weather.
Great, thank you.
Thank you all.
Next on our list is 5.2 from the Four Tides Hospice Society. We got Mallory Meeker, Leslie Emery, and Melanie Monroe. Looks like only one of the 3 are here. Welcome.
Hi, I'm Mallory Meeker, and I'm the current president at Four Tides Hospice Society. Melanie is in a meeting, and Leslie, you may know, is our community's on-call coroner, and she unfortunately was just called out. So I'm it for today. I want to thank you for your time. 3 things to cover quickly. I'd like to give you a little overview of Four Tides Hospice, for those of you who aren't familiar with the organization. Also an update on Hospice House, and then Four Tides Society has a specific ask, and I'll save that for the last. So first, very briefly, sometimes people are confused about the difference between palliative care and hospice care. So I'll just start by saying palliative care is medical care. It's the care that you receive from medical professionals at end of life. Hospice care is the social, emotional, spiritual care. It's delivered always by volunteers. That's one of our tenets, that when you walk with someone at that part in their life, it's not a paid responsibility, it's hard work. So we have trained volunteers who provide the services. When palliative care and hospice care come together, you can transform the end-of-life journey for people who are passing and their loved ones. Hospice has been around in Pal River loosely for, at least 30 years. This kind of loose network came together in 2014 and was incorporated as a charitable organization, Four Tides Hospice Society. We've grown since then with a pretty major break through COVID. But I'll tell you a little bit about the services. We provide one-to-one support for people at end of life, wherever they are, hospital, long-term care, home, whatever. We also provide the same kind of supports for their loved ones. We provide bereavement services, programs, and those can be one-to-one, or we have bereavement groups, bereavement walking groups, grief groups. Also, Four Tides does a series of workshops. Is this bothering you? I'm not sure where I'm supposed to be to make it work. Right there. I'll try to stay right here. We also provide a series of workshops throughout the community, advanced care planning, representation agreements, wills and estates. So that's the broad array of services. It's always surprising to me that a lot of people don't know that we receive absolutely no contractual government funding, nothing. We deliver these services free of charge to everyone in Cathet who needs them. And we do so through grants, fundraising, and donations. We have a very generous community. I know that there's copies of our annual report from last November floating around. I just want to point out a few numbers from that. In 2024, we had 41 active volunteers. These are the people that are journeying with the person at end of life, and we've just trained another 10. We served 292 clients, and I want you to remember that number, 292 via 1,224 visits. We did 98 group presentations in the year, and all of these programs and supports were delivered by 3,684 volunteer hours. In early March, I'm sure you all are aware, the BC budget was tabled, and while there was money allocated to mental health and to addictions and to long-term care, there was no additional funding allocated towards medical palliative care or hospice services. So some people ask, why then are you going ahead with Hospice House in this economic climate? And I can tell you why. First off, we have broad community support. In 2022, when we were coming back from COVID, we did a series of community engagement activities. Some of you participated in some of those. There were focus groups, online surveys, and planning meetings. We know the community supports this initiative. The second reason is because we desperately need it. People are dying in the hallways of our hospital. Since I've been president, I know of 2 families that we've had to support whose loved one passed in the hallway. We can do better. We can do better than that. So I want to move on to Hospice House, which is a standalone care facility that this community has been envisioning for quite some time. Please.
Just pause you. We have a short agenda, so I can't imagine any members of the committee or have a problem with going a little further. Okay, go on. Thank you.
I'll talk faster.
It's okay.
The vision for Hospice House, it's 4 to 8 beds. If it goes as big as 8, those beds, some of the beds will be used for pain management and for respite. We envision a home-like environment, each room private with extra accommodation for family to stay with individuals who are at end of life. We have an idea about grounds. Every room will have double doors that can open so beds can go out into a peaceful serenity garden. There'll be opportunity or space for private meetings with caregivers, doctors, that kind of thing, as well as meeting rooms. Spiritual, cultural practices will be honored for people who are there. Where we are right now in the process, we have a signed agreement with Vancouver Coastal Health. And some of you who've been following Hospice House, you may have Hospice House fatigue. It's been like one step forward, two steps back. This has been going on for almost 10 years, but now we have a signed agreement, and that gives us trajectory to move forward. That agreement designates Vancouver Coastal Health as the funder for operations, and they have committed to fully operate Hospice House once it's built. The community takes responsibility for the capital campaign. So we have a memorandum of agreement. Let me just double check Leslie's notes here. We've so far raised $2 million, and this is kind of without a big campaign. This is just generous people knowing that this is the direction we're going. We've just hired a professional fundraiser, and she has allocated a huge project plan. So our next steps are: first, secure land; second, commission the building site and building design; third, present that package to what we call legacy donors. We have a few people in community who have not committed, but let us know their intent to be major funders of Hospice House, and then launch the capital campaign for any shortfall after that. So that gives you an update on where the society is and where we are at Hospice House. So the first in that plan was secure land, and that's our ask. That's why I'm here. Four Tides wants to ask the city to partner with us. We want you to become a full-fledged partner in this adventure, and the way you could do that is by giving your planning department some marching orders to explore the possibility of locating Hospice House on city-owned land. And that's our ask. Any questions?
Thank you. We have a few. I'll start with Councillor Isaacson, then the mayor.
Thank you. I'm wondering if, well, first of all, thank you for your presentation. I'm wondering if you've looked at the land management strategy and existing parcels of city-owned properties and have like a wish list, or like have you explored the ones that are available so that we have a sense of where or what qualities you might be looking for?
We've done a little of that, but didn't want to get too far down that road without official sanction and direction to go there. I can tell you briefly that we probably need at least an acre. And I've talked to a few people about that. Accessibility is a big issue. It needs to be near a bus route. And you know, you can make land beautiful. So that part isn't as important, though a forested area or, you know, landscaping would be nice, but we can always make it beautiful.
Thank you.
Mr. Mayor?
Thank you very much for coming here and discussing. Very impressive what you've done to date. I think it's an excellent example of an organization that will start by raising money rather than just coming and asking for stuff. I think you clearly have some excellent volunteers. Question I have for you is, with regard to some of our 160 city-owned properties that we would like to utilize, could Hospice House be on a piece of land that was also serving another need in the community, or do you think it would be important just to have the property for your Hospice House?
Good question. Vancouver Coastal Health has given us a lot of latitude with location, model of operations. They're very supportive. We have not discussed a co-relationship in any way, but that doesn't mean that it's not possible. I think the biggest objective is to ensure that it meets the criteria around serenity, calm, quiet.
Okay. To the chair, is this an appropriate time to make a motion?
Yes, you may.
I'd like to make a motion that we request that our acting CAO contact the appropriate party within the city to have an initial discussion with Hospice House so that there can be clarity on the lands that may be available that the city owns that would meet their requirements.
Does that need us?
I was informed actually during the mayor's motion that our procedure bylaw, and the motion might be a little out of the bylaw because our procedure bylaw states we can't act on a delegation request until our next council meeting. So we could forward this on to the next council agenda and then bring it to further discussion over there. So we had Councilor Doe first and then Councilor Palmer.
I'm just going to suggest that we forward the mayor's motion to the next council meeting, which is on Thursday.
I don't think we need a vote for that, do we? No. Okay, so that will be done on Thursday. Did you have a question too, Councilor Dowd? Or?
No, I just wanted to speak to it. I think this is it's time to do this. I've been following the hospice ever since I came to town, frankly, the need for a hospice. And I know it's a need for a community, particularly one that's isolated as much as we are. I support what they've been doing. It's a major hurdle that the delegation has talked about, just getting an agreement with Vancouver Coastal Health to do the operation in the ways that are acceptable to the Hospice Society. And that's a huge hill to get over. I watched them trying to get that done, and it's been done. So now the next thing is to get busy and create a suitable plan. And to have a suitable plan, you have to have a place to do it. So having the Hospice Society get together with city staff and talk about which lands might be appropriate and would fit all the needs, the city's needs and the Hospice Society's needs, is really important. So I think we should get on and deal with it. We can pass this motion on Thursday, I hope, and get to work and maybe move things down the road.
Mr. Palm.
Thank you to Chair, Ms. Meeker. I know that your organization has been working hard for a long period of time on this, and it's nice to see you come forward and formally get some commitment from Coastal Health. And I believe that we have a number of parcels appropriately situated somewhere in the vicinity of our hospital that may be of appropriate use. And we are, without a doubt, spending a lot of money caring for our most vulnerable, that is the addiction crisis that we face. But this, in my estimation, is even more important to deal with since they're already getting funded. We need to do something for your organization, and I'm really happy to see this coming forward on Thursday. Thank you.
Thank you. Well, I just want to close by saying in BC, 4,500 people more or less journey on. In Pell River, it's about 315. So when you look at the fact that we served 292 clients last year, you get a sense of the amount of community reach that we're making. I think the city and Four Tides are going to make great partners because we know that this objective falls under your strategic priorities. So thank you so much for your consideration. Look forward to hearing from you on Thursday.
Just had one other question myself, actually, before you stepped away.
Okay.
The funds that you've raised, I imagine, assuming that the city can provide a property, the funds would be designed, targeted for the build of whatever facility you need to build, is the plan right now?
I'm sorry, I wasn't quite sure what the question was.
Yeah, my wording didn't come out very good either. So the funds that you've raised are earmarked for the building of the house. Would that be the idea?
Yes.
Okay. If there was a existing property in town that might meet some of the criteria, would it also, that was privately held, but needed some renovations, would it also be in the cards to use those funds to acquire said property and put the renovations in if that worked out?
Absolutely. In fact, in Gibson's right now, Gibson Seashell is just a little bit ahead of us in this process, and they've just purchased an 8-bed house. It was built as a B&B, and they've just purchased that, and they're renovating it. So, no stone's going to be left unturned in finding the right fit for our community.
Thank you very much.
Thank you.
Okay, moving on to new business 10.1. We have a letter from the museum regarding a development project. The writer of the letter, the president of the board of the museum, is in the gallery today, so he's already told me he's available if there's any questions that's there. But
You're skipping over 8.1.
oh, sorry, 6.1, my mistake. Yes, thank you, Councillor Dowd. So 6.1, the consent agenda. I totally missed that one, so.
I'll move adoption of the May 6, 2025 consent agenda.
So moved. Any discussion? Seeing none, all in favor? And that is unanimous. So now on to 10.1 on the letter from the museum. So for those in the gallery that haven't read it, the museum is looking to grow and improve and consolidate, and right now is asking council to provide a contact as a liaison to be part of that conversation process. I think sums it up pretty nice. So any comments, questions from the committee? Councillor Southcott.
Thanks, Chair. I had a conversation with the president of the board earlier because the letter did raise some questions in my mind, specifically as to how much involvement. It's not really clear what the board of the Museum and Archives Association really would be looking for, and suggested to Mr. Wall that he might turn up here. So I don't know if anybody else has the same curiosity, but I'd rather hear it again from Mr. Wall than through me, unless we, none of us do have that curiosity. And then probably there's a motion to be made.
Anyone opposed to a couple minutes from Mr. Wall? Okay, Mr. Wall, if you want to provide a couple minutes of clarity, please.
Again, thank you very much. Thanks for entertaining us. Just to kind of catch you up, the museum has reached out to the Tla'amin Nation early as an early kind of partner on this project, seeing that they would benefit from a space to tell their story as well as upgrading a space that our story is currently being housed in. So we reached out to them first. There were some other early pitches as well to join this committee, but so far it's just us. Now we have sent a letter both to we're at the stage now where we've sent a letter to the regional district and to city council to ask for liaisons from both the QRD and the city. The project management committee is meeting on average once a month right now. There are members from the Tla'amin Nation Executive Council, a cultural member from Tla'amin Nation, 2 members from our board, and we also have a consultant in museums who is he's a consultant for the Museum and Archives Society. So we're just exploring the options of what a new museum development plan and what a new museum project looks like. And again, this is mostly a comms, communications open line between council and the QRD and the city. So and the Museum and Archives Society, so that we can have some clarity. Everyone can know what's going on, and there's no surprises about who did what, when, where, and why. So I think with the monthly meetings, most of the commitment would be if you can make the meetings, great. They're mostly held over Zoom. If you can't make the meetings, Spark Notes could come out very easily from me or one of the other members, kind of highlighting what's been going on. And if there's something that we feel maybe needs to be more, have some more input from council so that it could be brought to council, or just a update, run of the mill. This is what we discussed. This is where we're at. These are the things we're doing. So like currently we're in the vision for the museum. That's one of the discussions we're in. Also what the new museum would entail. Those are some different things that we've been kicking around. So it's very preliminary, very early, but we'd like to go to press, and it would be nice to have all of the interested parties at least be notified and have the opportunity to join onto our project management committee before we put out a press release.
Thank you, Mr. Wall. We got the mayor, then Councillor Isaacson.
Yeah, thank you, Mr. Wall. I would suggest that anybody on council that's interested in being on this committee, let myself know, and on Thursday at the council meeting, we could put a motion forward confirming who would represent us at that.
And we could act on that today as well, since Mr. Wall is not an official delegation. Our procedure bylaw allows us to act on it today. So, but yes, Councillor Isaacson.
Thank you. You've mentioned project management committee, and then the letter says development committee. Same thing?
Okay. It is a development committee. So yeah, it's had, the name of this committee has moved around a few times, and that's a misspeak on my part.
Okay, thank you. And also through the chair, it mentions like infrastructure grants that that are available that you'd like to apply for. Are you at that stage of applying for like exploratory grants to help you with any preliminary work, or is it more, are you even more preliminary than that when you're looking at the vision and what is possible? So I'm curious what sort of, what type of communication or conversations would be happening at this stage?
So I think the way I understand the process, having everyone be notified and be on board with the committee gives us the opportunity to move on those grants. But right now, we haven't actively applied for any grant funding yet. But I think that's probably the easiest way to explain it. Yeah. Okay, I was looking at Bert, because Bert Finnemore is also in the gallery and is very much involved. Previous executive director of the Kithap Museum and Archive, and now is the vice president of the Kithap Museum and Archive Society. So.
Nope.
Yeah, I'm not sure what process the chair wants to use, but I would be willing to be a liaison to the museum committee if that's what council wants.
Someone want to make that motion? Oh, it's not coming from Councillor Doat.
Move that. That Councillor Doat be appointed into the mayor's hands on Thursday.
Okay. Any other further discussion? No, we can.
Be done today.
It can be done today, and it'll be done and over with. So if there's no further discussion, I'll call the motion. All in favor? That is unanimous. So
Perfect.
Councillor Dout will be the liaison. You can be in touch. 2 Georges now.
2 Georges.
Moving on to our lengthy agenda over here. Item 13 is public clarification. So chances for people in the gallery to get questions on any topics on the agenda for a maximum of 2 minutes. Do we have Mr. Glinski, anything from you? I wish I could take the credit for being efficient on this case, but anyone else in the gallery? Seeing none. Mr. Tate, anyone online? No one online. Okay, well, if the gallery can give us 2 minutes to read our next motion, and then we will adjourn. Councillor Isaacson.
I move that the committee move into a closed meeting to discuss matters covered by the community charter under sections 90 part 1 L, I think that is, discussions with municipal officers and employees respecting municipal objectives, measures, and progress reports for the purposes of preparing an annual report under section 98 annual municipal report.
All in favor? is moved unanimously, and so we will reconvene for our closed meeting. So thank you everyone for coming out.